Of people in Kentucky and Indiana have been tested for COVID-19. Dozens have been confirmed, but not everyone asking for a test is getting one. It's a big question you've been asking, meaning some could be infected and not even know it. Tonight, investigative journalist Shay McAllister is tracking down the tests. Shay, what'd you find?
Well, Doug, all major area hospitals are working under order from the state to, quote, conserve and prioritize, meaning they're only testing those at greatest need because our testing capabilities are just very limited right now. As for when we'll have access to widespread testing, state leaders say it's out of their hands. This letter from the Cabinet for Health and Family Services to all Kentucky healthcare providers describes limited commercial availability of necessary lab components, meaning there isn't enough lab equipment for our community's testing needs.
We hope that in the near future that there will be widespread testing. We don't have a timeline for that. And every time we get a timeline, it seems to be extended.
2 weeks ago, the Kentucky Health Commissioner said the CDC is looking at the commercial industry to produce more kits. That's what we're waiting for. But right now, COVID-19 testing is limited, only for those sick enough to be in the hospital or people who work with vulnerable populations like staff at jails, nursing homes, or schools. Once the test swabs are collected, shipped to a lab for testing, processed, and then sent back to your doctor, it could be several days to get results. And in Indiana, more of the same. State leaders say they're waiting on more test kits, hoping they come later this week.
So the message that we should take home for all of you is this is the beginning and this is real.
Meanwhile, local hospitals say the number of test kits they have on hand is changing constantly. So they're working to control what they can by limiting visitors and suspending elective surgeries. For Focus, I'm Shay McAllister.
Thank you very much, Shay.